So today my topic of discussion is Cushing syndrome. So now I will discuss about Cushing syndrome. So Cushing syndrome was discovered by Dr. Harvey Cushing. So first of all, when we start Cushing syndrome, at first we must know about acetate hormone and cortisol. So first start with it. The first question, there is a hypothalamus. And in hypothalamus there is a position called paraventricular nucleus, from where corticotropic releasing hormone is released, and it goes to anterior pituitary and stimulates the corticotropic cell of anterior pituitary to release the adrenocorticotropic hormone. So first what? Paraventricular nucleus, which release corticotropic releasing hormone, which further stimulate corticotropic cell of anterior pituitary, and the corticotropic cell of anterior pituitary releases adrenal corticotropic hormone, which comes in the adrenal gland and it acts upon it. In case of adrenal gland, there are primarily two parts. One is adrenal medulla, and one is adrenal cortex. So today we will discuss about adrenal cortex only, not middle. In adrenal cortex, one is zona glomerulosa, one is zona fasciculata, and one is zona reticulans. From zona fasciculata, there are the releasing hormone are glucocorticoid. The main glucocorticoid is cortisol, which is generally endogenous steroid. Which cortisol is released, then go to body tissue for act, and it also go to add hypothalamus and anterior pituitary through negative feedback mechanism for suppressing. What suppresses? It generally suppresses ACTH level is down and CH level is down. So finally, cortisol is in normal level. And one other mechanism, if someone takes the exogenous steroid, which is prednisone, and it is a glucosteroid, in medication it can be taken, and it also acts upon hypothalamus and anterior pituitary. It reduces CRH and ACTH, which further also suppresses the ACTH. So here what happens? Exogenous steroid suppresses endogenous steroid or cortisol. So next part, what are the causes of Cushing syndrome? We can take a short reminder or a short trick that CAPE or CAP. C for Cushing's disease, A for adrenal adenoma, P for paraneoplastic syndrome, and E for exogenous steroids. So let's discuss about Cushing's disease. So what is Cushing disease? In case of Cushing disease, there is hypothalamus, anterior pituitary, and kidney, and here adrenal gland. So what happens in Cushing disease? That in the anterior pituitary or pituitary gland there is adenoma, and which adenoma can increase the level of ACTH. We know that in case of adenoma, the hypersecretion of gland happens. So when ACTH level is increased, it also increases cortisol level because ACTH acts on adrenal cortex. So thus Cushing disease occurs. Then adrenal adenoma. In case of adrenal cortex or adrenal gland, if adenoma occurs, then cortisol level automatically increases. And paraneoplastic syndrome means ectopic ACTH. If ACTH is released other than anterior pituitary, we can take a case that small cell lung cancer. When small cell lung cancer happens, there is ectopic ACTH release. In the lungs, there is some cell which can release ACTH hormone and which go to adrenal cortex and release cortisol, which will further cause Cushing syndrome. And exogenous steroid, that is prednisone, If you take higher dose of this medicine for longer time, this can also cause Cushing syndrome. If you shortly recap, CAP, one is Cushing disease, one is adrenal adenoma, one is paraneoplastic syndrome, and one is exogenous steroid. So Cushing disease can also cause Cushing syndrome, adrenal adenoma can also, paraneoplastic can also, and exogenous medicine or steroid can also. So now we are going to know about the features of Cushing syndrome. First of all, the patient face with round face or moon face or Mongolian face also can be seen. The patient can also get central obesity or truncal obesity, abdominal striae or stretch mark. In the abdominal region, there is some stretch mark or abdominal striae. Enlarged fat or buffalo hump. In the neck region, there are some fat can get stimulated and this can happen. Then proximal limb muscle twisting. This means the extremities or hands and legs will become thinner. Then male pattern facial hair in women. In case of women, there is a hair growth, facial hair growth happens. Then easy bruising, insomnia, anxiety, depression, this type of general disease. And the metabolic defects, first of all, hypertension or higher BP, because we know that cortisol is a stress hormone which increases the blood pressure to maintain that, and this can also happen cardiac hypertrophy, type 2 diabetes mellitus. Then we can also increase, it can also increase cholesterol and triglyceride in the blood. This can also cause dyslipidemia. Dyslipidemia is what? The increased amount of cholesterol and triglyceride in the blood. And it can also create osteoporosis. This means the bone will become thinner and becomes weak. If the acidage amount is any increased in body, then it can create skin pigmentation. How? Because ACTH can stimulate the melanocyte. Melanocyte cell is cell present in skin, and melanocyte cell release MSH, melanocyte stimulating hormone, which will secrete MSH to melanin. And increased amount of melanin will become skin pigmentation, and it will increase the darker color of skin. So it is an important sign for determining the Cushing's disease. So in case of Cushing disease patient, we can found skin pigmentation. But adrenal adenoma and exogenous steroid, there is no skin pigmentation. So you can reminder. So this can be a reminder that in case of Cushing disease patient, there is pituitary adenoma, and it can also create the skin pigmentation. If we take a deeper look, whenever the adrenal adenoma happens, it can create higher amount of ACTH, and this higher amount of ACTH will create higher amount of MSH, and this will create higher amount of skin pigmentation because of melanin. This type of skin pigmentation can also happen in primary adrenal insufficiency. What is primary adrenal insufficiency? It is adrenal failure or adrenal gland failure. In this category, cortisol level is decreased, highly decreased when adrenal gland fail. The negative feedback mechanism which we have discussed here, this cannot happen, and anterior pituitary release more and more amount of ACTH hormone, which will increase the quantity of ACTH, which will further increase MSH and increase melanin, and thus skin pigmentation occur. If we take some, how we can define the Cushing syndrome, we have to know how this disease can be diagnosed. So now we go to diagnosis part. For diagnosis, there is a test for dexamethasone suppression test. So here what we do, we can give a dose of dexamethasone. It is synthetic glucocorticoid, and our work is to monitor the level of cortisol. Monitor the level of cortisol because if in the dexamethasone, it generally in the mechanism of negative feedback mechanism, it will decrease the function of hypothalamus and pituitary because it releases CRH and ACTH, and this quantity will be decreased. This will further decrease the quantity of cortisol also. In case of Cushing disease, we can see that level of cortisol will be decreased, no problem. But in case of adenoma, there is no further any amount of change, and cortisol level will highly increased. And in case of Diagnostic syndrome, there is also no change. And in case of exogenous steroid, there is also no change. And first of all, we give there are two doses there. First, we give low dose, then high dose. If you give the lower dose, then the pituitary adenoma, there is no suppression of ACTH because adenoma is higher amount of secreting ACTH, and the lower dose cannot cope up with that. But higher dose can cope up with that and suppress ACTH. And when it suppresses, it also increases cortisol. Or further test 24-hour urinary-free cortisol, and blood test we can get that WBC will be increased and production will be decreased. We can also do MRI of brain, CT scan of chest, and CT scan of abdomen. MRI of brain, pituitary adenoma, CT scan of chest, in case of Diagnostic syndrome and small lung cancer, and CT scan of abdomen for the adrenal gland. And what about the treatment part? Treatment, we can do some surgeries and we also do some medication. In surgery, there is one surgery called transsphenoidal surgery, that is pituitary adenoma. In case of this, we can surgery of pituitary adenoma. And surgical adenoma, we can do also that. If there is a tumor in adrenal gland, then we can do surgery of adrenal gland. In case of small lung cancer, we can do the tumor treatment through surgical removal, and also we can do the adrenalectomy. What is adrenalectomy? We can remove the two adrenal glands, and we can give the patient a therapy called steroid replacement therapy for lifelong. Because if there is no cortisol, then the patient cannot manage stress. So that's why he must take steroid replacement therapy. And one medicine called metadone, that is used to decrease the level of cortisol and treat the Cushing syndrome. So I think this is all about Cushing syndrome. If you have any query, then you can say me in the comment. I will try to give answer, and also comment down in which topic or in which category you want the next video. Thank you.